tell you about oral candidiasis. See, the word oral candidiasis means there is fungal in the oral cavity. See, normally in everyone's body, let it be skin or oral cavity or inside, you have bacteria, virus, fungus. It's normally present. Do you know that a normal person, they breathe in fungal spores? And you know the quantity, how much we take in? Normal person, 10 raised to 7 times fungal spores you breathe in. But nothing happens to anyone. So normally it is seen. But in some conditions, in an unhealthy condition, when the patient has got a problem inside the body, this fungus, it gets activated, it becomes pathogenic. Means it can, by itself, it can produce a disease. Now, there are so many causes, common causes, I will tell you a few. And before that, let me tell you, this oral candidiasis, this is a potentially malignant condition. So what do you mean by pre-malignant condition and what is potentially malignant condition? Pre-malignant condition means this condition can become malignant. Potentially malignant condition means there should be a pre-existing disease which can turn malignant, and along with that you have this candidiasis. In that case, this can turn into malignancy. That is the meaning of potentially malignant condition. Next, let me tell you what are the common causes of precipitating factors for oral candidiasis. Smoking, alcohol, those who are taking antibiotics repeatedly, those who are taking the proton pump inhibitors, antacids repeatedly, and likewise those who are taking inhalers to control bronchial asthma, and especially if they don't know the proper way of taking inhalers, those who are taking immunosuppressive therapy for and they have undergone organ transplant. Diabetic patient, their sugar is not under control. Denture, they are using denture, but they are not maintaining the denture properly. Even in malignancy, they already have malignancy in the body, like oral malignancy. These patients also can. Leukemia patients, they also can. And severe infection with AIDS patient also can. So all these are factors which can trigger a fungal infection turning into pathogenic. Now, these are the common causes which I have mentioned. Now coming to the complaint. This can be asymptomatic, means there will be no complaint at all. This patient, maybe they walked into our OPD for some other related condition, and when we examine, we have the findings which is suggestive of oral candidiasis, and when we ask them, are you diabetic? Is your sugar under control? That time they say, no, I am diabetic, but it is not under control. Then we come to a diagnosis. And majority of the patients, they say that they have a burning sensation. They are not able to eat properly and continuously they have oral irritation. So on examination, we find, like how you see in this picture, we find white patches everywhere. And when we try to remove the patch, it easily comes off. Why I am saying like that? Because there are other conditions on the oral cavity where you have white patches, where when you try to remove the patch, it starts bleeding. But here it doesn't bleed. It's not necessary that all the patients should present in this particular pattern. Some of the patients, they come just with redness throughout the oral cavity. See, actually, oral candidiasis, you have 8 different types, but I am just mentioning the most common type. Now, coming to the diagnosis. It's a clinical diagnosis we can come to know. We just need to know details about some more details about the patient complaints, patient other comorbid conditions. Now, if you want to come to a diagnosis for sure, what we need to do is we take a swab of the white patch, white curd-like structure which you see, and send it for fungal stain as well as for fungal culture. But usually this is not necessary. And sometimes when you feel that maybe this is not only in the oral cavity, it is spread down to the throat, or maybe it is in the food pipe too. In that case, to check if it is spread down to the throat, we need to do a flexible endoscopy. And if you want to know if it's in the food pipe, we need to do a esophagoscopy. But normally it is not done. It is done only in those patients, like for example, diabetic patient and sugar is not under control and he has been having this condition for a long time and they are complaining of some discomfort always in spite of taking medicines. Now, coming to the treatment part. Treatment is very simple. But we have to stop the offending or the triggering factors. Unless you do that, we will not be able to control this. The triggering factors in the sense, stop smoking, stop taking alcohol, and if you are on repeated antibiotic, please do stop that habit. And those who want steroids, they have to reduce the dose or find an alternative. And immunosuppressant therapy, they have to take it, they cannot avoid it, but they can be an alternative for a few days. And diabetic patient, the sugar has to be under control. Those are taking, they are using dentures, they have to maintain the dentures properly once this oral candidiasis is managed well. So all these offending factors have to be brought under control. After that, at the same time, what you do is we use antifungal paint. This antifungal paint, we have to apply 4 to 6 drops right in the center of the tongue, and take it around all the oral cavity, and you swallow it. So this has to be done daily, 4 times daily, morning, afternoon, evening, night. And keep in mind that once you apply it for next 1 hour, please do not drink or eat anything. So you can take it after breakfast, lunch, and half an hour after tea in the evening and after dinner. So main point is this medicine has to be in contact with the area for 1 hour, and you should not drink anything or eat anything. Now, at the same time, a few more points I want to tell you. That is, those patients who are complaining of burning sensation in the oral cavity, try to avoid oily foods, spicy, hot and spicy foods, and take balanced diet, more of vegetables, more of fruit juice. Please do avoid citrus fruits like lemon, pineapple, orange juice and all that till the condition is getting controlled. And drink plenty of water. And do not overbrush your teeth trying to remove all the white patches. No. Once you take treatment, it will go by itself. So this is how we manage oral candidiasis. And I am telling you about straightforward case of oral candidiasis, not the complicated ones with other involvement of esophagus and all. Thank you so much.